So it's a really good idea to start to acquaint yourself with your pelvis during your pregnancy so you get an idea of where the baby is going to be coming from. So our pelvis is like a bowl, and this is what I'm actually sitting on right now. Our spine grows out of it and our legs come out of it, and there's a lot of forces that go on in here. Our baby sits right inside, and as it grows, the uterus comes out and grows with it. So getting an idea of the bony landmarks of our pelvis is really good because our pelvis is going to start to expand, and it's really going to start to expand when we go through labor. So first we're going to look for our what are called our Asises, or what a lot of us call our hip bones. So these are right in the front on us. They're right here. So you find those bony parts in the front of our hips, and you just kind of get an idea of, okay, there's the front of my pelvis. Okay, from here you can walk down to our pubic bone right here, which joins the two halves of the pelvis together. This is an area that can cause some pain with some people, so it's a really good idea to know where that is. We can walk back up to those hip bones, and then we can walk back to our PSISs, or the bones right in the back of our pelvis. I'm going to switch to the side so you can see that they're right at the base of the spine. From here, you can walk down and find the tailbone. Again, the tailbone can also be a spot where it can be uncomfortable, especially if we do a lot of sitting back like this in this slouched position. We're sitting right on our tailbone. As you can see, I just flattened my hand. And then from there, swing back around, we find our sit bones. That's what I'm sitting on right now. So you can place one hand underneath one side of the pelvis, the other hand underneath the other, and you can feel those two bony parts. You kind of wiggle around, you'll feel them moving in your hands. You can also do your pelvic tilts in this position, and you'll feel how they go back and forth. So again, these really expand as baby gets bigger and as you get ready for birth. So it's a really good idea to know where these landmarks are so that you can start to pay attention to the changes and the shifts that happen in your body.